Hi, I'm Dr. Jimmy Lebrec, and today we have Dr. Kristen with us, one of our Elevation Health medical provider. And today we want to talk about the fact that the world is about to restart again. And that means all of us are going back to work. It could be next week that it's full blown. It could be 2 weeks or 5 weeks from now. We don't really know how all of this is going to play out. However, we have to start living again. And we want to talk about what you guys should be prepared for so that you have the best chance of never know that you've fought this virus. And we want to make sure that you're the person or the people who never infect another person, so that you have clear conscience and also no fear. That's what this whole thing is about, having no fear and having a life full of function and the best life possible. So Dr. Kristen, what should people do right now as they are about to enter the workforce again, or hey, in the fall, what's going to happen when all of us are going back to school?
We're reuniting with family, and not all of our family is non-immunocompromised. So we want to take care of the people we're around who may have a harder time fighting this disease. So, and also we want to protect ourselves. So the best thing would be to test. We want to know if we've had it and if we can transmit it to other people.
Okay, so there's a lot of confusion out there. The FDA has approved testing, but nothing has been highly tested or recommended, and they don't have any clear guidelines. It's kind of like a big mesh pot right now, and everyone doesn't know what to do or how that's going to play out. The FDA is getting some, and the CDC is just trying to gather as much data as possible. So should I get the $60 test from Abbott? Why should I get the $150 test or the $250 test from Vibrant? Like, what should we do and how should we do this?
So if we're going back out into society, we want to be the most prepared. So we want to know, have we had it, and can we transmit it to other people? So those are the two things we want to know. And Quest and LabCorp both have tests that they may be less expensive, but they're less expensive for a reason. They're only looking for one antibody of one antigen of the COVID virus.
And how many antigens on the COVID virus?
There are 10. We have a test that we use that actually looks for 4.
And I'm assuming it's because we just don't have a whole lot of data on that virus yet, and we can't really test for all 10 antigens right now.
And keep in mind, all these tests are emergency pushed through the FDA, so all of them are emergency testing. They waive a lot of the restrictions that normally happen.
I understand.
To go through testing.
So can we go through an example of somebody that got tested and
Sure.
see what
Most tests provided by Quest and LabCorp, they are looking at either nucleoprotein of the antigen or nucleoprotein antigen of the virus or the receptor binding domain of the virus, one or the other. And what these are they are different parts of the virus, different areas that they're picking up on. Like we said, there are 10. There are 4 that can be tested, but these labs are only testing for one or the other. So they are testing for one. The reason we are testing for 4 here in the office is because not only are we testing for 4 different parts of the virus, we're also testing for 3 different antibodies that our body makes to fight this virus. So we're not actually looking for presence of the virus, we're testing for our immunity reaction to the virus. Now, if you had a test from LabCorp or Quest, they would look for the nucleoprotein IgG. And the IgG tells us, do we have long-term immunity? And this patient who would have tested with Quest or LabCorp, they would get negative. So they would say they have not been exposed, they don't have immunity, they need to be careful. But using 4 antigens, we are looking at these all 4. And the spike glycoprotein right here, that one is telling us not only do they have immunity, yes, they do have immunity, which contradicts what the first lab said, but also they are still infective because IgM looks at, are we still transmissible for the disease? So this person would think that they need to stay home and protect themselves more, when really, yes, they need to stay home because they can infect other people, but they also are developing immunity. So there are 2 completely different results from having testing on this.
So that person in this case here, is just a few days away from being done fighting the virus and is going to have long-term immunity and will no longer be contagious. Not only that, but we can even use their blood to help other people fight off whatever they're fighting off and help them out, right?
By donating the plasma.
Yeah, so that's fascinating and awesome.
But I think the key part of this is they're still able to transmit the disease because they don't know they have it from that test. And that's the scary part of the one antibody testing.
And that's why we want everybody to get tested, but not just tested properly to find out where are you at. And then we at EH Medical will offer the solution based on where you're at as to how you can protect yourself, your family, your grandparents, and the immunocompromised friends and families that are around you. So please call 817-577-6061. Again, it's 817-577-6061. We do this test. The test costs us, and you can look on Vibrant Health website, the test costs us $150. We are charging $250 so that we can pay for the supplies that we need towards that test and the interpretation of the test, and also going over the results with you from our time perspective. So part of that might be covered by insurance as far as our time based in this. The test unfortunately is not covered by insurance yet, but again, don't you want to know so you can start your life properly and live the way you should be without fear? That's what we think. So again, ehmedical.health is our website. 817-577-6061. Come see us. We'll help you find out if you have been able to be fighting off these diseases properly or not. Dr. Kristen, thank you very much for your time today.